announcements in relation to some changes as we head through this period. Can I begin by thanking our frontline staff, particularly our health staff, our doctors, our nurses, our paramedics, our cleaners, our O call operators, who every single day over the last 2 years, but particularly during this last period of time, are doing an amazing job and an extraordinary effort in keeping our people safe right across our state. It has been an incredibly challenging 2 years. Many people are tired, but our health system remains strong because of the efforts and the tireless work of our health staff right across New South Wales. So can I begin on behalf of all the people of New South Wales, thank you very much for everything that you do. The key point today is what has led to our success here in New South Wales has been our vaccination rate. And the efforts that everybody across New South Wales has made in going out and getting vaccinated has ensured that we've been able to get through this challenging and difficult time. I want to put forward today our continued effort that needs to be made right across our state to get boosted. We are seeing probably from 17 January, we'll get up to around 300,000 booster shots administered per week in our 40 hubs alone. But once again, can I say, if you haven't been boosted and it's been 4 months since your second dose vaccination, please go out and get boosted. You can do so at your GP, at your pharmacist, or importantly, at one of our 40 centres across New South Wales. And Susan Pearce will speak to, we also have outreach going out to regional and remote communities to assist in that booster shot program. Coming from Monday, we will have, as we've announced earlier this week, we will provide an opportunity for children aged between 5 and 11 to also receive the vaccination program, and that will once again occur in our hubs across the state, but also importantly for many parents today, you can also, and what would normally occur in the natural course, have that vaccination take place in your GP. So make an appointment from Monday next week, and that will ensure we continue to keep our kids safe, our friends and family safe as we move through this next period of time. Today we will be releasing modelling in terms of the hospital capacity here in New South Wales. We move through this system. We've modelled 3 different areas over this period of time as pressure on the health system builds over the next few weeks. This is in line with what we did during the Delta outbreak. What is encouraging from this model is that even on a worst case scenario, we have the capacity in our health system right now. So obviously around the country, around the world, during this pandemic, we are seeing significant pressure on our health system, but our health system is strong. We've invested significantly. We have the best health system here in New South Wales in the country, if not around the world, and that is importantly supported by those great men and women who are making those efforts each and every day to keep people safe. And once again, I want to thank our health workers for that. In order to assist the health system during this period of time, just like we did during the Alpha outbreak and the Delta outbreak, today we are announcing that we will continue to suspend elective surgery for non-urgent surgeries. That's category 3, which is elective surgery that's non-urgent in the next 365 days until mid-February, and also we'll be engaging with the private hospital system to help with capacity constraints over this period of time. We did that during the Delta outbreak and the Alpha outbreak, and we believe this is the right approach right now to help, as you'll see through that modelling. And Susan will obviously speak to those capacity issues as we move through, and following this press conference there'll be a detailed opportunity for members of the media to sit down with Susan and our health teams to go through that further. In addition today, as we've seen, those significant queues have eased in relation to PCR testing. We are making an announcement today that as we move to rapid antigen tests over this next period of time, we will be counting those positive RAT tests just in line and including them as we have with PCR testing. So what we would say to people today as we move through this period, that if you do receive a positive rapid antigen test, that you register that through Service New South Wales and New South Wales Health, New South Wales Health and Service New South Wales have been working on and will be available next week, by mid-next week, a system that if you do have a positive rapid antigen test, that you treat that as if it was a positive PCR test, and that you isolate in accordance with the rules that are in place. And Dr. Chant will provide some further information in relation to that. We will be seeing here in New South Wales from next week, we put 50 million orders in for rapid antigen tests. We expect them to be arriving early next week, and we'll have something to say in the next few days in relation to the distribution of those rapid antigen tests in conjunction and alongside the distribution that will be occurring at the federal government level. Now, we've always said that as we move through this pandemic, we will continue to monitor our hospitalisations and ICU capacity. So today we are making some sensible and proportionate changes as we move through this next period as the peak of Omicron comes through. And so those changes will come in from tomorrow up to Jan 27, where the other restrictions remain in place. Those changes are as follows. There will be no singing and dancing in hospitality venues. That does not include weddings or performers or classes that people may be conducting. In addition to that, major events will proceed. This information out today. In overwhelming majority, major events across New South Wales will proceed. Health is currently reviewing those, and if there is deemed to be a high-risk venue, New South Wales Health, along with the Department of Premier and Cabinet, will work closely with organisers in adjusting those COVID-safe plans. So if you have a major event planned throughout January, continue as planned. There are no changes to any of those events. They are continuing as planned, only in circumstances when New South Wales Health deems that event to be a high-risk event. Then we will contact those organisers and work through the current COVID-safe plans with you. As well, today we are saying, as we have in the past, we continue to encourage people to minimise mingling where possible. If you're in a hospitality venue, if you can sit down while drinking, please do so. Minimising mingling during this period of time obviously provides greater assistance across the board, and also with household visitations, please, where you can, minimise those household visitations. And as well, when you're having events inside, if you can have those events outdoors, we highly recommend it. Whilst it's raining today, it's been raining this week, we're in the middle of summer, it's a great opportunity to move indoors, outdoors, and that will assist as well as we move through this period. The other change today is in relation to, which we'll provide more information on as we move forward. The other change is in relation to mandatory vaccinations. So there are a number of workers here in New South Wales that we have deemed to be in high-risk settings. In those circumstances, we have mandated vaccinations. We will be moving to those mandates, including a booster shot. So the Health Minister is working through that at the moment, but that announcement today will ensure that whether it's our teachers, nurses, our frontline health and disability workers, where New South Wales Health has previously required mandatory vaccination for certain frontline staff, that we will move to boosters being included as part of that fully vaccinated determination. So can I end where I began, and that is thanking our health workers. They've gone through so much over a difficult period of time. Our health system, though, stands strong because of them and because of the substantial investments that we have made. The modelling today is encouraging. Whilst it will be a difficult few weeks in New South Wales, our people and the effort we have made to go out, to get vaccinated, to get boosted, has been key to opening up our society, to living alongside the virus. This is a challenging time, not just in New South Wales but around the world, but the efforts that our people have made has kept New South Wales safe, has kept New South Wales open and kept New South Wales strong. And if we can continue, thank everyone for their patience, particularly those who've had to line up in PCR queues and the like. We continue to be patient and continue to treat people with kindness and respect. Once again, we'll come out stronger the other side. I'm now going to pass to Dr. Kerry Chant, who'll provide a public health update, and then Susan Pearce will speak to the hospitalisation modelling and also the continuation of our booster shot program.
So just a bit of an overall summary of what we see, the picture before us. In the last 7 days, we've got about almost 50% of the cases are aged between 20 and 39 years. So there's 29% between 20 and 29, and 30 and 39 account for 19% of the cases. The transmission is happening in a variety of settings, obviously in those household and social gatherings that people are having, and also in places like pubs, clubs, nightclubs. And the concern around the behaviour of dancing and singing, I suppose, just to explain to people why we're picking on that as a transmission mechanism, is the fact that when people are in those environments and dancing, you're actually encountering and bringing together people from very different social networks. So when you go and sit down with your 5 friends in a restaurant and you're just sitting down, the only people that you're really coming into contact with our mask-wearing rules, with the hospitality staff wearing masks, you wearing masks until you sit down, is that group that you're with. But when you're actually dancing on a dance floor, when you're energised and singing in a group and moving around, then you're actually risking exposing people that you would normally day-to-day not come into contact with. So at this time, we're really just trying to slow the spread, reduce the introduction to new social networks as a mechanism of slowing the spread, to remove that peak, blunt that peak in the projections that my colleague will share with you, in order to reduce the impact we're seeing on our hospital and those other critical services in the community. Across Sydney, we've got clearly a very high case burden, and I think I've mentioned before that the numbers of tests positive that we report every day will be an underestimate, and that's also because we're moving to incorporate RAT testing. And there will be a proportion of the population that may have asymptomatic disease, so no symptoms, and so the total burden of COVID will probably not be really known until we do those surveys I talked about historically, which are those serosurveys, where we look at what proportion of the population were actually exposed and immune through exposure to the virus. But that means that we need to now reflect on a different approach to testing, and the Prime Minister from National Cabinet announced the RAT testing, but I'd just like to put some details around the approach in New South Wales. So what we are saying, that if you have symptoms and you can get access to a RAT test, now I'd like to preface my comments now that I know that many people are struggling to have to get access to RAT test, and in that circumstance, please get a PCR test in the meantime. But we know that the supply of rats will be increased, both in the private sector and through distribution arms that the government are putting in place. And we also know that people are effectively sharing them through anecdotes, that some family members might have them and they might be able to pass them around or share them. So please use those stocks to get the best outcome we can. In terms of rapid antigen testing, what we're saying is if you're positive with symptoms, then treat yourself as a case. In this current setting of such high case numbers, if you've got symptoms and you've got a positive RAT test, then you're a case. We're also saying that if you're a household contact or you've had those high-risk exposures, then also you're positive, you're a case. Now, if you've had no exposures to anyone, it's really unusual that you have got a positive test. Under those circumstances, you might get a PCR to validate it or test again with the RAT. But at any time you've had a positive test and developed symptoms, you should act as if it is a positive test. We're also asking you, and this is not covered in a public health order, that you would actually isolate for the 7 days, and also that your household would take that action. Now, currently we were working with our partners in Service New South Wales to establish a mechanism so that you can actually register your positive RAT. And then we will change the orders so that there's a requirement where you get the information so that you will then be required to isolate as if you had a PCR positive test, and you get the same experience as if you did that. Now, moving forward, we're also keen, we're not as interested in absolute case numbers. What we're very interested is making sure the right people with COVID are getting the care they need, if there's interventions we can do to support better outcomes or to manage their underlying health conditions. And so many people with COVID, and as you experience, friends and colleagues experience COVID, you'll see that many people are experiencing a mild illness. Anywhere they might describe it like as a flu-like illness, some might even have milder symptoms. But we do know that there's some groups, particularly those with underlying chronic health conditions, people that are pregnant, people that, and chronic health conditions also encompasses obesity, people that are unvaccinated, people that have particular conditions that suppress their immune system or are taking drugs that actually actively suppress their immune system. We know that they may have a high risk of hospitalisation and admission to ICU. It's important that those individuals are linked to care, and in those circumstances we will be reaching out to those individuals through the systems a bit aligned to what we've got in place for the PCR testing. So our main issue is many people will be able to self-manage. If you've got a positive RAT, treat yourself as if you've got a case, isolate, get your household to isolate, get them all to do RAT tests. But the key issue is you can self-manage, but if you've got any of those chronic health conditions or those risk categories I spoke about, we do want to link you to care, because there may be some therapies that we can administer that will reduce your risk of going into hospital or requiring ICU. We are updating all of our information sheets, and we are going to try and make this information more accessible and easy. In terms of the other messages, I just wanted to echo the Premier's comments just to reinforce and explain the sort of key messages. At this time, limit your social networks. So if you normally hang with interact with a certain, sorry, I shouldn't, never, a middle-aged person or an older person should never try and use any language like that, so apologies. If you can just stay with the groups that you normally engage with. Don't go into environments where you're mixing more broadly. If you are going to those big family events, and there'll be those special events such as weddings and those very sad events such as funerals, you may want to use a RAT test. Again, I know not everyone can get them, but if you've got one, that's a good preventative method you can have. But my key message is please do not go out and about if you've got symptoms. Please stay at home, get access to a RAT test, or if you can't in this time where we're in this transition, where supply will gradually improve very markedly over the coming weeks, obviously have a PCR test. But particularly if you're in any risk categories, we want to make sure that you're linked to care, because that is our absolute priority. There are some fact sheets on our website, and we'll provide some links to them, which also tell people about practical steps to prevent them going to things like maintaining hydration, making sure you're keeping your fluids up. So there's very practical things you can do to manage at home. But if you've got any of those health conditions, you may need that extra care, and we want you linked to care. My other comment is that clearly our emergency departments and our 000 call line is under a lot of stress. Just remember, it is there for emergencies. I do not want anyone delaying calling that if you've got chest pain just because you think it's going to be too busy managing COVID patients, because that will actually end up causing more stress for the system. So everyone who needs help can get help, but we just ask those people that may have other ways of getting into hospital with those minor conditions that could be dealt with in other ways, that they do not ring 000. Keep 000 for emergencies. Thank you.
Thank you. We have been working on the modelling now for several days, and working with experts to understand the experience not just here in New South Wales but in fact overseas. Look, modelling is complex, and we'll explain that more after the press conference, but the point is that we take a lot of factors into consideration, and included in that of course are case numbers, but there's a lot more to it than case numbers. At the moment we're looking at the conversion rate to hospitalisations here in New South Wales. So we've got our own data now to work through. And what is interesting in that data is that we are seeing a much lower length of stay associated with people with Omicron who do end up with a hospital admission. The point about that, though, is it still places a very significant degree of stress on the health system, because people moving in and moving out and moving in and moving out takes a lot of work for our hard-working health staff each and every day. There is some positive news that we're starting to see emerge in this, though, and that is we're measuring the conversion rate between cases as we know them, and what that then translates to in terms of hospital admissions, and that conversion rate is coming down. So that's a very important factor that we're continuing to monitor each and every day as we move through this period, and we'll continue to look at this and measure the actuals. What you will see there are three different scenarios. The scenario which we consider the worst case scenario at present, on the information available to us, has been modelled on the experience in New York, taking that into account and the factors that apply here. The middle line is the line that we think is the most realistic of the three at the moment. And that takes into account our own experience here in New South Wales. It considers factors such as the health of our population, our vaccination rates, and a lot of inputs to result in that curve. And as I mentioned earlier this week, what we see in these curves is that they rise sharply, and there is also a relatively sharp decline. Based on this information at the moment, and again, it is a model and we will need to continue to monitor it, we believe by the middle of February we will be certainly well past the peak of this, and we expect that peak to occur in around the 3rd to the last week of January. So we reiterate, we have got some challenging weeks ahead of us. But we have been planning for this pandemic and continuing to reinvent ourselves for 2 years now. Omicron has thrown us a fresh set of challenges. It's thrown our health staff a very significant fresh set of challenges. And none the least because of the impact on furloughing and the fact that our own health staff are personally affected by this. We've been working with the private sector now for a long time, and one of the positive outcomes of this pandemic is that our two systems are as close together as they've ever been. We briefed our private hospital colleagues yesterday about the changes that we need to make to get through these next few weeks. And while we've made changes to elective surgery and we talk about non-urgent surgery, can I be clear to those people on the receiving end? It is not a decision that we take lightly. It is not something that we consider unnecessary surgery, and we appreciate for every single person on the receiving end of those phone calls, it creates distress. What we've demonstrated previously is that when we've had these surgical slowdowns, and it's slowed down at the moment because of the Christmas-New Year period, we have managed in our system to work very hard, again, along with our private hospital colleagues, to catch up as fast as we can. We will continue to make those efforts, noting that we have a health system that is very fatigued, but I did want to express to people that is not a decision that we take lightly or that we see it as just a simple tap that we turn on and off. We do not consider it in that way. Moving to the boosters, we obviously are working also very hard in our vaccine clinics, as you know. As the Premier's mentioned, by the 3rd week of January and toward the end of January, pending our workforce, we certainly are aiming to be back up around the 300,000 doses a week. We will be contributing to the rollout for 5 to 11-year-olds across the state. But we note that the bulk of that work will be done in GPs and pharmacies, as it was for the 12 to 15-year-olds. Nevertheless, our clinics, our vaccination clinics, have played an incredibly important role during the entire vaccine rollout and will continue to do so. And this week has been great to see the numbers lift. We were around 16,500 on Tuesday. It's been over 18,000 the last 2 days, which has been great to see. Can I echo the words of both Dr Chant and the Premier? We thank our health system right across the board, public, private, GPs, pharmacies and everybody involved in this effort. We will get through this and we will continue to make sure we work hard to support our system as we go forward. Thank you.
Questions?
Premier, you pushed ahead with lifting restrictions despite warnings about Omicron. You're now having to put restrictions back on. Does this backflip show that your decision to open up and to live with the virus was the wrong one and has failed?
We're seeing case numbers rise right across the country. We've always said we'll tailor our settings to the circumstance that we face. We've always said the focus is our ICU capacity and our hospitalisation capacity, and that we will tailor our settings and make appropriate changes as we move through. It's more than likely as we move through into next year, as we move into winter, further changes might need to be made. We will always make the assessments that are in front of us at the time, based on the facts and the evidence that is in front of us. And there's no doubt what we know about Omicron compared to Delta and Alpha is that whilst it's more contagious, it's less severe.
So you have no regrets about reopening?
That provides further challenges in relation to furloughed staff, and as a result, we made some changes late last year, and we're making some proportionate and sensible changes now. We have kept our society open. Now, certain people would like to go into lockdown. That is not our approach, and the reason we won't do that is because we have a highly vaccinated population. We have a healthcare system that, whilst under pressure, like all systems around the world, as you can see from that modelling today, even on a worst-case scenario, is in a strong position to deal with the challenges that we'll face over the next few weeks.
Premier, this modelling that we have been given today looks pretty good because we've got the hospital bed capacity, but isn't it showing only half the story here, with the main issue being furloughed healthcare staff and healthcare staff that cannot manage these hospital beds? So why isn't that included in the modelling that we've been given?
Well, Susan will provide some further information in relation to that, and we are monitoring that each and every day at both a state and federal level. So, for example, frontline healthcare workers, aged care workers, as furloughed staff become a challenge, and that's what we've been seeing here and around the country, but not just in our health systems, but in our distribution networks. So we continue to look at ways in which we can revise the close contact setting. We've made some changes already, but we know that, as you quite rightly say, Kenny, the one issue with the beds, and whilst we're under pressure, just like we were with Alpha and Delta, that we are in a good position, but that does not mean that we are not under pressure, that there are not challenges ahead, but we are very, very confident that we are in a very good position to get through this next challenge. Susan, do you want to make some further comments in relation to staff?
Just a comment with regard to the workforce. I do reiterate that we obviously consider very carefully our workforce, and you'll note on that model we've revised down quite significantly the number of ICU beds available, for example. So that is indicative of the fact that we understand that to be able to surge ICU you need staff. So we've revised that number down considerably as a consequence of that. But there's a lot of work going on in the background right now. And look, I'm not suggesting that this is easy or that we've got the perfect solution to everything. But the reality of it is that we will get through this period with our wonderful health staff. If I need to put on a uniform myself and go and work, I will. We are calling out everyone who is a registered health professional, for example, who may be able to assist us during this period. But the point is that we've been working on different models for 2 years, and one of those that's happening right now is we're looking at care assistants who can go in and help the more experienced staff. We're looking at bringing, if possible, interns on early. We're looking at nursing graduates who may be able to be brought on early. We've upskilled registered nurses who could assist in critical care. We upskilled physios who could similarly assist. We will be looking at our models of care as we work through this period. And I want to give our health staff some reassurance and hope that we will continue to do that, and that fortunately what this model is showing us at the moment is that, and we feel that these predictions are accurate based on, or relatively accurate based on, what overseas experiences have shown, that this will rise quickly and pass quickly. And we need to also reassure our community that we will be able to manage this.
Premier, do you think things could have been different if you hadn't made restrictions last month? We wouldn't be seeing the current surge of cases now.
No, I think you would see exactly the same, and that's been brought out right across the country and right across the world right now. We are seeing exponential increases in cases right across the board. In Victoria, very similar settings to what we have here in New South Wales. And that's what we've learned through this pandemic. Every variant brings different challenges. The positive news in relation to Omicron, as we're seeing play out globally, is that whilst it's highly variant, what we are seeing is that it has a much less severe impact. Now, with higher case numbers, that brings challenges, particularly to the points that have been made in relation to furloughed staff. But we believe that the changes we make today are moderate, proportionate, but importantly, ensure that as we get through this peak, as we've always said, we continue to monitor our ICU and hospitalisation situation daily. We provided this modelling today to the public, so you understand what we're looking into as we move through this period of time.
With respect though, if you say it would have been exactly the same number of cases had you not eased the restrictions, why are you bringing the restrictions in now then if it's not going to make any difference? As
we've said, that the changes that we made last year were very minor. We moved from highly recommending masks to mandating masks from a week period, from a 1 week period. Now, in addition to that, the QR codes, and as we've seen, QR codes have created challenges, particularly with PCR testing queues, and the utility of those QR codes are naturally reduced right across the country as we have an uptick in cases right across the board. But we believe as we head into this 3 weeks, as we've always said in every press conference along the way, we monitor our hospitalisations, we monitor our ICUs, and where we need to make some changes, we will. We obviously have made change today which in the main encourage people. We continue to encourage people, and the great efforts that people are making across the state have ensured we've kept people safe. And whether that's moving indoor functions to outdoors, whether that's encouraging people to reduce mingling where you can, as Dr. Chant has pointed out, reduce major gatherings in homes, use common sense, and that's exactly what the people of our state have done over the last 2 years.
Premier,
self-reporting of the rat test,
yeah.
Seriously expect people to self-report if they're tested positive?
Well, we'll be mandating that, just like they have in Victoria, and we'll have something more to say about that next week.
So what happens if someone doesn't self-report?
Well, we're working through that, but what I would say is that it is important for that self-reporting, particularly for people who have underlying health conditions or who are elderly or unvaccinated, because in those circumstances what we'll do through the Service New South Wales app is connect people into the health system. So that's why we've made that change. It's in line with the changes that have been made in Victoria. Obviously, if you have underlying health conditions, we encourage you to contact your GP. But as we know, in the main, this disease is more mild, in many cases asymptomatic, but we will still be saying if you do receive a positive rapid antigen test, please register it through Service New South Wales from mid-next week.
Premier, we know about a pharmacy in Sydney that wanted to, or contacted a supplier of rapid antigen tests.
Yeah.
Wanted to order $50,000 worth of rapid antigen tests, but the supplier said you can't order that because the government has said the priority is for the government in terms of the allocation that the government wants to get from the supplier. So the pharmacy was rejected. Yeah. Isn't that counterintuitive to...
Well, just on that, what we have done in conjunction with the federal government is to procure a number of tests. And that's important. And we'll make some further comments in relation to our distribution. We see our distribution here in New South Wales to provide support for more vulnerable people, for our school system, and we're working through that at the moment as those tests arrive next week, because particularly we want to make sure from day one, term one, kids are back in the classroom, and as we move through this next phase of the pandemic, there's no doubt that rapid antigen tests will play an important role. Now, in relation to the federal government, obviously through their procurement that they're undertaking, we are seeing in the private sector that we were working through this yesterday with New South Wales Health, we are seeing substantial procurement of rapid antigen tests for pharmacists and for supermarkets as well. So that is the role that will occur. Now, obviously, as we move through this next week or so, there will be a shortage. But rest assured, at the Commonwealth and state level, we're doing everything we can. We want to alleviate and ease those queues, those PCR testing queues. I think we're already seeing over the last couple of days a reduction. It's still not perfect and people are still showing a lot of patience, but we are transitioning to that approach, and I believe it's certainly the right approach as we move to more personal responsibility as we head through the next phase of the pandemic.
Dr. Chant, can we ask you a question about the risk assessments that New South Wales Health will be doing for major events? What sorts of events do you think might be at risk of cancellation? Would that include things like the music festival that was held in the Domain on New Year's Day? Admittedly, it was outdoors, but there were thousands of people jammed in together, all on top of each other, and there have anecdotally been a lot of COVID cases that seem to have come out of that.
Look, our risk assessment has to be proportionate where the other settings are, because we do acknowledge that people are taking a lot of the actions themselves under the current settings. I would give examples just to explain our sort of factors that we take into account in risk assessment. If you're sitting down, it's a family-friendly event, something like carols in the park, in the local park, that's a very low-risk event from us. What we're really interested about is those events that promote really lots of mixing between different groups.
Mosh pits?
Mosh pits, things that bring people to very close proximity. Now, we do know that outdoors is a really key mitigant, but it's not perfect, and if you're very, very close to someone, you're still going to potentially transmit, particularly if you're doing vigorous activity and you're not wearing a mask. So I think we need to just look at these events. I think the settings that we've got now, where we've got no singing and dancing in those 3 settings of hospitality, entertainment, major rec, that will take a lot of, be very clear to the community at the threshold. And we do ask the community, while some of our recommendations are advice, for the community to think about that. So if you're going out with a group of friends, just keep it to a smaller group. We take out, I'm really pleased though, just want a big call out, I haven't got out very much, but when I have walked around the neighbourhood, there's been some great initiatives where I've been really pleased to see the cafes and restaurants opening their windows and doors. I'm glad it hasn't been a bad mozzie season, but it's been amazing to see those sort of behaviours. And I think the community is also responding by really appreciating those businesses that are promoting the outdoor use and taking those steps and identifying what they see as really COVID-safe practices. So that gives you a flavour of what we'd factor into the risk assessment.
One of those big events coming up next is the Country Music Festival in Tamworth. A lot of people in a lot of different venues. Would that be one that should be...
Well, for instance, clearly the announcement today has just come in, and I would expect places like the Tamworth Music Festival, and I understand that's a lot of different connected events that hang off, will have to assess for themselves what the impact of these restrictions are. But clearly it will change the character and flavour of some of those venues and significantly reduce the risk. But I think that's a matter for the organisers, and it's probably too premature for me to comment. But clearly our local health teams have been working with council at safety measures, and regardless, we want all businesses to do as much as they can to improve the COVID safety.
Just on rapid test reporting, don't you need them to report negative rapid antigen test results as well, so you can see how many infections there are against how many tests are taken? And also, because of the inaccuracy of the data that we're getting now, isn't it maybe time to overhaul the daily reporting of these COVID numbers?
Exactly, and as a person who loves reading the data and looking at it, it doesn't tell you the full picture, and that's why no longer I look very much at the variety of different data sets. I look at the testing, because some of the positive cases we're reporting today are actually cases from a couple of days ago. So we also report, which you've seen in our EPI report that we put out, the test date, because that gives us an indication of what the percentage positive is on a certain day. So I totally agree with you, but I wouldn't, our aim is not to get every single test, because some people, I think the comment was before, not everyone is going to register. We have to use multiple resources, and what I'm most concerned about personally is that I know that people with rapid antigen testings are getting the right advice and are linked to care.
So that's a waste of money then, the self-imposed rapid testing. You just said not everyone's going to use it, so what's the point of even bringing it in?
Because many people in the community comply. And if we explain the reason why we want you linked to care, one, because we want to be able to give you advice about whether you're in a risk category. We want to be able to give you information about what call numbers to ring and what support is available and those resources. That's a really valid reason why I think people will register positive RATs. The majority of the community has been so amazing in adhering to both public health advice and complying with orders. But what I'm saying is the primary interest for me is making sure that we do link people to care. We will be doing perhaps other surveys to look at what behaviours people have had in terms of RAT testing to inform us in our knowledge of what proportion of the population is acting on a positive RAT or what proportion is reporting. But that single number of registrations will be an underestimate of the numbers. But that doesn't cause me grave concerns because I will be looking at multiple different data points to understand how we're travelling, and one of those will be hospitalisations and ICU, one of it will be test numbers, but increasingly that becomes a smaller proportion of the evidence base for understanding our trajectory.
But I guess what I'm saying is because the case numbers now, you yourself are saying there's way more cases in the community than what's been reported, so what's the point in continuing to report these case numbers if they're so inaccurate?
Well, I think they just give an indication. I think I've been before you for a few press conferences, and I've never stood away from every time we report case numbers. There's an underestimate. I think to give you an example, way back in the first wave, that's such a long time ago, but it wasn't until we did a sero survey where we look at how many people were actually impacted in that wave that we probably were, for every case we were detecting, there were a number of cases in the community that were unrecognised at that time. So this is a usual part of the complexities of disease surveillance, and there's varieties of ways of triangulating that information. So for me, please do report when we set the system up, report your RAT as positive. You'll get some really helpful information. I would urge everyone to do that. I'd urge everyone to take those protective actions for them and their family about isolating, and for the household to get RAT tests and for the household to isolate. And I would also urge you to be conscious of the conditions and fill out the questionnaires that will link you to care. This is really important as we're moving forward to make sure that most people who can manage COVID at home safely manage it effectively that way, whilst protecting others from the spread. And then the group that needs care gets linked to care and the therapies.
And how are you expecting that pathway to play out? So how will you get treatment to vulnerable people, for example, who put their hand up and say, I've tested positive, and you don't want people putting pressure on emergency services? What does that look like?
So at the moment, I'll just talk about the systems we have in place for our PCR testing. That's probably easier, and a similar system or analogous system will be set up for the RAT testing. So someone gets a PCR positive result from the lab, public health then texts you and goes through what your obligations are for you and your family. And then we have an automated system that analyses your risk stratification based on information we've got. We then tell you if we don't know everything. So, for instance, we wouldn't have visibility if you're pregnant because that wouldn't be something that's recorded well on your history. Or we may not know that you've had a new chronic underlying health diagnosis. We ask you to identify that, and then we allocate you to a care level. So there'll be a large number of people that will be said, manage at home, but tell us if we haven't picked up on a risk factor you've got, because it's not visible to us that you've got any risk factors. But those that we know about that are risk factors, and that's through matching it against data we've got in our health system in terms of managing someone for their cancer or their underlying respiratory condition, we will triage them to a higher level of care where they'll get called and we'll get them assessed about whether they need the therapies.
It sounds very reliant on technology.
There are also call numbers as well, but it's really pleasing to see the system's been in operation for many, many weeks. Obviously, we can always improve its reach, but it's actually performing very, very well. And I also do thank the community. It's amazing when we send those text messages, the community do actually take it seriously. There is some translations embedded in it to make it more culturally and linguistically diverse friendly. We're always open to new suggestions about how we can do it better. But the main issue I've got is we do need to link certain people into care, and there are therapies that can improve the outcome, and that's the focus of our, approach at the moment.
Yeah.
We're hearing that a lot of people, especially people with non-language barriers or I guess, reading abilities, are actually not being told how to use the rat test properly. They're using them incorrectly, they're testing negative, and they're going out into the community and they're actually positive. So I guess what are we doing to kind of inform people or tell them and get rid of barriers?
Yeah. Multicultural New South Wales is playing a very important role here, and obviously in diverse ethnic communities we want to make sure that information gets out. There will be challenges along this way. There's no perfect system, and as we transition from PCR testing, which is obviously administered by pathologists and private providers in New South Wales Health, it's obviously more automated. Now, as we shift to this system, there'll be difficulties on the way. But we will iron them out as quickly as we can. We want to provide clear information to the public in relation to that. We'll be providing more information next week in respect of positive tests, registering through Service New South Wales. And as Dr. Chant has said, it's incredibly important that people actually do register. And that's why we'll be mandating it. Because part of the success has been to date, as Dr. Chant has said, that we've been able to connect people with a positive test early on who might have an underlying condition into the healthcare system, or at least provide that advice in. People can get further advice on the health website, but in terms of translation services, Multicultural New South Wales is working on that as we move through the next phase.
Last question.
Just adding to that about boosters.
Yeah.
A lot of people seem to think that once they've tested positive, they don't need to get a booster shot. What's the advice around that?
Oh, well, booster shots are required. My understanding is that ATAGI is updating its advice. Obviously, if you've just been tested positive for COVID, there needs to be some time provided prior to your booster shot. And my understanding, Dr. Chant may want to provide further information, but that advice will be coming out shortly in terms of the interval period between recovering from COVID and then going out and getting your booster shot, because COVID itself acts in the short term as a booster. But Dr. Chant, do you want to add some further?
I think that's clear. We have requested that ATAGI give us very clear guidance, because this question's coming up a lot more. But the principle is that when you've had Omicron or you've had COVID, we don't know which one, Delta or Omicron, both are circulating, it's like acting like a booster. So you can delay. It's not really a delay, it's just waiting for a period afterwards. But ATAGI will give some guidance. But given where we are in the wave, I think it's reasonable to say wait for 4 or 6 weeks before the booster, but we'll have more definitive information from ATAGI.
A lot of children will be fully vaccinated by the time school starts. Do you think that we should shorten that gap?
Look, we'll obviously review the information as it comes. I mean, at the moment, our priority is, we've got multiple priorities for our system, which is both providing boosters to those that are at risk, where they've got potentially waning immunity, and we know 3 doses is more effective against Omicron. So I'm really very keen to make sure we're vaccinating our over 65s and our people with chronic health conditions, to make sure that group's vaccinated. I think we're doing a good effort in getting our children vaccinated. Also a big call out for those 12 to 15-year-olds. I get very depressed when I see that number stick at 81.4 or 81.5% for first dose. So I'd love to see that number come up a little bit higher before school. So at this point, we're keeping it under review, but at the moment, there's a lot of priority groups for vaccination and many competing priorities.
On the shooting yesterday, are you worried about the daylight shooting yesterday? Are you considering more resources for police in this escalating gang war?
Look, we have resourced our police force incredibly well over this period of time, but clearly, I would say that the police will hunt you down and lock you away and throw away the key. This criminal activity on our streets is unacceptable, and I have full confidence in the police force that they will catch the perpetrator and lock them up.
Sorry.
I was going to say, on schools, Queensland Karen said
Yeah.
that she was going to consider pushing starting term one back after their case surge. Is that something you're looking at doing?
Now, our commitment is to get kids back in the classroom day one, term one. Now, I spent yesterday with the health and education teams in relation to the finalisation of our plans here in New South Wales. I think it would be best to have a national approach, and that's the plan going into National Cabinet. But to the question, clearly different states will be going through a surge at a different point in time, and you might require different settings. So, for example, some of the measures that we would put in place when school goes back here in New South Wales will probably be very similar to Victoria, but very different to Western Australia. So we're working through those plans now. We are completely committed to getting kids back in the classroom on day one when the school term begins, and we'll finalise those plans. If we can reach a national agreement, that'd be great, but otherwise we'll take our own approach.
Are you looking to implement a public health order to require people who get tested positive through a rapid test to isolate the same way they do through a PCR test?
Yeah, it's exactly the same approach. So that's the change we've made. If you test positive with a rapid antigen test, you are to isolate just in line with how you would isolate for 7 days in circumstances where you have a positive PCR
When will
test.
that system be in place?
You know, the restrictions would have made a difference to case numbers, but do you think you could be better prepared for this, especially in terms of hospital capacity? Mr. Pearce will talk about some of the extra steps. So do you think you could be better prepared for this case surge?
No, I think as Susan Pearce has pointed out, we have, going through Alpha, going through Delta has provided great lessons for our health system, and we're already seeing the change that we're making today on non-urgent elective surgery are very similar to those that we undertook with the Delta outbreak, and that proved to be quite successful, and we have built up and invested significant amounts in our health system. At the start of the pandemic, I as Treasurer, I said to the Health Minister, or whatever you need to provide the strongest health system possible, we will provide. We invested $4 billion over that period of time in our health system. Our health system is strong. Yes, there are pressures. There are pressures right around the world. We are in a pandemic. There will be challenges that come along our way. But not only have we invested record amounts, we have the best health teams in the country. And I want to thank them, like Susan and Kerry have done, for the efforts that they have made. Because 2 years, this has been a long pandemic around the world, and it's been our health frontline workers who have kept us safe during this pandemic and will keep us safe as we approach this next difficult few weeks.
Sorry, Premier, some research out from ANZ today has found that it's been the worst week for spending in Australia since Delta, particularly bad in New South Wales. Your focus on opening up has been to try and stimulate the economy. What's gone wrong?
Opening up is the best thing we can do for our economy. Now, clearly, in the middle of a pandemic, when cases rise, that will dampen confidence. But ultimately, the alternative is to lock down. We will push through this difficult period of time. We've done it successfully over the last 2 years. With Omicron, you take a different approach. It is a different variant of the virus. It is much less severe, and the approach we have taken is the right approach to keep society open as we move through, and we'll get through this next few difficult weeks. We'll come out the other side, and as we have today, our society and our economy is open. New South Wales has led the way when it's come to having our
economic spoils aren't here, though.
And what you will see in every state around the country, as Omicron cases rise, confidence at that point in time will dampen, and then it will recover. We've seen that. As Treasurer, I've seen that over the last 2 years as we've moved through and made the changes, the necessary changes that we've made at various points in time. As we've said, particularly in relation to restrictions, throughout this entire pandemic, throughout the entire Omicron pandemic, that we will always tailor our settings to the circumstances that do the following: keep our people safe, a focus on ICU and hospitalisations, and at the same time keep society and the economy open and keep people in jobs. And when you look at where we sit today in New South Wales, even at the budget last year, the approach this government has taken every step of the way over the last 2 years has ensured we have one of the lowest death rates in the world, and at the same time, one of the strongest economies in the world as well.
Last question. How do you expect schools to function when so many teachers can be off sick or
Yeah. Well, that's a challenge we're working through. Just like the health system and just like distribution, that will be an issue. I'm very confident with the plans that I went through yesterday with our Department of Education. We are preparing for that challenge as we move through, and when we have something to announce shortly, we will do so. But clearly, that is an integral part of our plans moving forward.
And just on your decision making, are you giving yourself a gold star at the moment? It seems like
I think New South Wales is in a very strong position. We have a strong health system. Yes, it's under pressure. So are all health systems around the world as Omicron cases increase. But if we look at our death rate, it's one of the lowest in the world. We've always had challenges with this pandemic. When we're going through the Delta outbreak, the same issues we faced. We issued the modelling at that point in time and showed what our plan was and what our strategy was going forward. And we delivered on that strategy, we delivered on that approach, and we came out stronger the other side. As we move through this Omicron variant, we have to assume there'll be other variants that come along the way as we move through 2022, but we are incredibly well prepared. Yes, there is pressure. There is pressure in a pandemic, but we are completely focused on keeping people safe, on protecting our health system and keeping people in jobs. That's what we've done for the last 2 years, and that's what we'll do going forward.
Thank you. This was saying earlier this week, it's a perfect storm of staff going on leave and surge in cases furloughing staff. So surely one of those arguments, staff going on leave, that was preventable and foreseeable, wasn't it?
Say that again?
If you were preventing staff from going on leave over this period when we were expecting cases to surge...
Are you saying health staff?
Yes, health staff.
Look, obviously over the last couple of weeks things have increased and the pressure on the health system has increased as well. But it was very important to recognise that people do need a break. So, there is that fine balance. And at the moment, I know that some people have been asked if it would be possible to postpone leave and so on, but that is an absolute last resort. Our health system staff do deserve a break, and that is the fine balancing act that we continue to perform.
It's different from saying they don't deserve a break. I mean, in terms of standing up student nurses and other people, you yourself, you're willing to put on a uniform. I mean, you could have...
That will be politely declined by our health services, I suspect, but yes.
But you could have planned for that a couple of months ago when we were expecting a surge of patients, surely.
A couple of months ago, we didn't have Omicron. This is I think the important point here is that really, over the course of the last month, since the start of December, the change has been rapid and very significant. To suggest that a couple of months ago we could have foreseen this, I think, is not right. What we have done in preparation for this is to consider what sorts of mechanisms we might adopt. And obviously over the Christmas-New Year period, surgery is always reduced as a consequence of staff going on leave and people not wanting to have their surgical procedures. So presently, whilst things are busy and pressured in our health system, we have managed that occupancy despite those challenges, but it is thanks to the hard work of our staff. More and more people will be coming back from leave, obviously. We do have a number of staff furloughed. We need to keep working through those challenges, but you can't dream up workforce plans overnight. So the types of strategies I've talked to you about are things that we've been contemplating for some time. And as I mentioned the other day, there's a lot of work that goes on in the background in our community setting as well. There is, as Kerry's mentioned, that text messaging work that we put in place well before this and on the back of the Delta outbreak has been critical to protecting the hospital system from further demand. And also with our ambulance service and the virtual care centre that we have in ambulance, they are managing to call people who may otherwise have required an ambulance response and safely manage those with expert medical staff. Those are the types of strategies we've put in place. We've expanded them and invested in them. We will continue to do that. But ultimately, some of our staff obviously needed a break at the end of the year, and that remains a balance.
Thank you. One more question. Sorry, just one more question. Just in terms of the vaccine rollout, I mean, you've got... sorry.
This is the last one.
Sorry. the plan is to get it up to 300,000 states after by the end of the month.
Yes.
Now, is that just a result of slowly reactivating it, or is it a problem with staffing and supply?
No, look, again, over the Christmas New Year period, obviously, again, a lot of the vaccine clinics weren't open their full operating hours. We're ramping back up from this week. We've still got capacity in our clinics, so we knew that. The other thing that we've learned, of course, along the way with the vaccine rollout is that we, and supported by Kerry, of course, authorised a lot of people to be able to give vaccines. And so we're employing those strategies again and asking people to come forward and participate in that. The great thing about the vaccine rollout, our health staff that work in those centres really enjoy it. It's a very positive thing to be doing in a pandemic because it has delivered such a great result. So every time you go to a vaccine clinic, you find health staff that really enjoy working there, and so that has made it easier for us to attract people into those settings.
Thanks a lot.